Well, joining us on the broadcast, Dr. Randeep Guleria, the director of the All India Institute of Medical Sciences. Thanks so much, Dr. Guleria, for joining us. Your first reaction to the efficacy data that's been put out by Bharat Biotech.
I think this is great news because this really shows that the vaccine does work. We already had data from phase 1 and phase 2 which showed good neutralizing antibodies, and there was also enough data to suggest safety, but one wanted to look at the efficacy data. However, one should keep in mind that this is interim result because they need to have, I think, about 130 or 140 odd COVID positive cases to really analyze the data. This is interim result of around 40 or 43 subjects who got COVID-19, and they looked at how many of them were in the placebo arm as compared to those in the vaccine arm. But the interim result as it is right now is very, very encouraging, and I think it should put all sort of doubts at rest, and we should really look forward in terms of promoting this vaccine also in a big way as far as our national vaccine program is concerned, because we need to really vaccinate a large number of people in our country to be able to prevent the pandemic from further progressing.
Right. When you say that, more data is needed in terms of studying people who were actually infected with COVID-19 despite having gotten the vaccine, what do you really mean? Because what we understand is that this is the largest clinical trial ever being conducted in India, which is 25,800 participants as opposed to the Oxford trial, which had only 1,600 participants in India.
Correct. So in terms of the number of people who are enrolled in the trial, this is the largest trial conducted in India in Indian subjects. But really, to see the efficacy, you want to have a sufficient number of people who get infected, who get the infection with COVID-19. And then you don't know which group has got the vaccine and which has got the placebo. When you have a sufficient number of people who got infected, which can give you a statistically significant number, which is calculated before the trial was done and the sample size was calculated, then you can say that yes, this is the efficacy which is based on a good number which is significant, and currently the data is interim. So after the 43 events that they've had, that means 43 individuals out of the 25,000 odd that were in the trial got COVID infection. They then broke the code and saw how many of them actually got the vaccine and how many of them were the placebo, that is in the arm which did not get the vaccine. And in the placebo arm, there were 36 people who got COVID infection, whereas in the vaccine arm, there were only 7. So based on that, the calculation showed that the vaccine efficacy is around 81%. But we will need to have around 130 people who get the infection. And then we again break the code and see now how many of them are in the vaccine arm and how many of them are in the placebo arm to get a real life data in terms of the real efficacy data. But the interim result is very, very encouraging, and I think that should be a big boost to the vaccine program in our country.
I think that's a very important clarification, Dr. Guleria, that you're making, and we will of course further elaborate and clarify that for our viewers as well. But when you say this interim result is extremely encouraging, but we need for at least 130 people to be infected to study this further, will phase 3 trials therefore be ongoing as far as Covaxin is concerned? How are we to read this?
Phase 3 trials will have to be ongoing till we get enough data to achieve the significant number that was decided before the phase 3 trial started. So your sample size calculation and the number of events that you need to really get a statistically significant number is decided once before you start the trial, and therefore you have that number already, that we would like so many infections to occur, and then we will look at how many of them are in the vaccine arm and how many of them are in the placebo arm. But you always do an interim analysis to make sure that you're going in the right direction and the vaccine is effective. So that interim result is very, very encouraging. So that should be a big boost, because this comes in the background of the phase 1 and phase 2 trial. But you will need to really continue with the phase 3 trial until you get sufficient number of people who are in the trial and who have got COVID infection.
All right. So the phase 3 trial will continue till there are sufficient number of people who've actually got infection for us to study this better. What are the next steps then, Dr. Guleria, now that efficacy data or interim efficacy data, as you're calling it, is out? We already know that, the vaccine is being administered in India, but what are the next steps that follow?
I think there are two steps. One is that everyone needs to be reassured that the data is encouraging, and this is enough for people to really move forward and come and get the vaccine. And any vaccine hesitancy related to the Covaxin should no longer be there, and they should come forward and get the vaccine. At the same time, like we're saying, the study needs to continue for some more time so that we have a sufficient number of people who get COVID-19 infection, who get infected by the virus, and therefore we are able to see what is the final efficacy, which may go up also as we follow up more and more people who get the infection.
Right. Will this data be peer reviewed at this stage, or will
Yes,
they wait for more information?
So it will be peer reviewed. This can also be sent for a publication as an interim data while waiting for your final data to be there. And I think that would be very good if they are able to give this data out and get it peer reviewed and it comes into the public domain so that everyone can look at it critically, both in terms of what was the protection, how much did it protect from severe infection, did it give some protection even from mild infection or not getting the infection at all, and did it protect you from, what was the mortality benefit that it had. So there is a lot of other secondary endpoints which can also be looked at as far as the data is concerned, and therefore it would be good if it is out in public domain.
Right. I have two very quick questions. One is that the participants were aged between 18 to 98 and 4,500 participants had comorbidities. Is that encouraging, especially given the fact that we are in phase 2 vaccination trial where we're targeting the elderly and those with comorbidities?
Definitely. This is very encouraging because many of the vaccines that were initially out excluded those with comorbidities or those who were really the elderly age group because they wanted to, they were not sure about safety, and they were also wanting to see the efficacy in a group where the immune response would be robust enough. So again, this is something which is very encouraging. And as we get more data out, it would also be useful to see what was the protection in those over the age of 60, what was the protection in those who had comorbidities, and was it the same as compared to those who were less than 60 years of age or in the younger age group and those who did not have comorbidities. So that would be also interesting data to look at, but very, very encouraging results.
All right, very encouraging results there. Dr. Guleria, thanks so much for joining us. You yourself have gotten both doses of Covaxin. So hearing all of this information from you is very reassuring indeed. Thanks so much for joining us.
Thank you very much.